everybody. I am Dr. Nirmala, Senior Gynecologist Consultant at Green City Hospital, JP Nagar 6th Phase, Bangalore. I would like to give you some information. Probably we'll discuss about only diet in pregnancy. Diet in pregnancy has to be high protein diet. High protein is the dictum. For vegetarians, it has to be boiled sprouts, and for people who take mixed diet, it has to be either chicken or fish or boiled eggs, which includes only white and not yellow. The diet, why I am telling it has to be a high protein diet is, when people stick on to high protein diet, they gain very less or adequate weight gain will be there, which will not make them put on more weight, and which is helpful in the growth of the baby and to maintain the health of the mother. Now, after the diet of protein, I would like to tell about the other things that a woman should be taking during, a pregnant woman should be taking during pregnancy. First 3 months, I know it will be difficult because of vomiting sensation, nausea and things like that. They will not be able to eat well. But as much as possible, try and eat whatever I will be suggesting now. But from 4th month onwards, you have to be strictly stick on to the diet that your doctors advise. So initially it is morning and evening one has to take milk, which has a lot of B complex and calcium. And morning breakfast, it is better to take South Indian because it contains a lot of protein and B complex, and it's fermented, so it has more B complex. Idli, dosa, upma, poha and things like that. For afternoon and night, it has to be strictly lot of leafy vegetables, then people who take vegetarian diet, sprouts. So all these 3 items in the food is a must in large quantities. And rice should be hardly a small cup of rice, or it can be brown rice or unpolished rice, but whatever it is, it has to be just 1 small cup of rice with 1 chapati or 1 jola jawar roti. And night also the food has to be the same. For people who take non-veg, it has to be leafy vegetables, and again as I told you, chicken or fish, large quantity. We don't advise mutton because it is more of fat than just protein alone. And then along with this, they'll be taking as usual brown rice or unpolished rice and 1 chapati or jawar roti. In between these 2 meals, it has to be only fruits and dry fruits. Mind you, I have not mentioned about anything. So that goes to say that nothing else to be taken. It's only fruits and dry fruits. In fruits, pregnant women have to avoid only pineapple. They can take all other fruits. Dry fruits also, they can take all the dry fruits that are available, and also those seeds like melon seeds and pumpkin seeds, etc. But what about fruits and dry fruits? There is slight restriction for fruits and dry fruits for women above 60 to 65 kgs, or we'll take it as 65 kgs and above. Should not be taking too much of bananas, mangoes, grapes and chiku, sapotas. All other fruits they can take. But the women who are less than 60-65 kgs can take all the fruits available except pineapple. Dry fruits also above 65, they should be taking only badam and walnuts and all other seeds. But women who are less than 65 can take all the dry fruits including the seeds. There is no restriction. So now, since I have not told anything else, it's understood that people should not be taking any sweets, bakery items, chocolates, ice creams or homemade sweets also, or sweets made of palm jaggery, etc. Because that is only going to add to your calories. It will make the mother put on weight. It will make the baby have more. If mother puts on more weight and develops diabetes or hypertension, which she is prone to in pregnancy, then the baby is also prone to develop diabetes, hypertension by the age of late 30s and early 40s. That is why these are all called as high protein diet, and next time we will talk about exercise.